Hi everyone.
Welcome to our podcast, Health Data Decoded.
I'm Ed Hill.
And I'm Samuel Ball.
We are researchers working at the University of Liverpool in health data science, and we are part of CHIL, the Civic Health Innovation Labs.
CHIL is an interdisciplinary team of researchers, NHS staff, local government and charities looking to use data and artificial intelligence to improve health outcomes in a responsible way.
This work, as well as bring innovation and improvement to health, can also help with our social well-being and the economy.
In this podcast, we'll be interviewing collaborators, researchers and professional support staff within CHIL to better understand what they do in their roles to improve health outcomes for the local area.
We'll be delving into questions such as, what are their day-to-day tasks? How did they get into the role that they currently have? And what advice would they give if you are interested in getting into this area of work yourself?
So join us in our journey to understand better how we can use data to tackle global health challenges and local ones within the Liverpool City region. Hi everyone, and welcome to Health Data Decoded. My name is Samuel Ball.
And I'm Ed Hill.
We're joined today by Albert Brennan. He's a data engineer within CHIL. Hi Albert.
Hiya, how's it going?
Good. So we just wanted to ask you a few questions about your job and how you got into it, what the job involves and what your day-to-day is. Mm-hmm. So could you just start by explaining to us what a data engineer does?
So I basically work as a cross between like a software engineer and a data engineer at CHIL. So it's quite a varied role just due to the small team that we have. So it involves various things really. A lot of it is taking data from various sources and ingesting that into our cloud environment so it can be used for other things. I also do things like build supporting web applications that researchers can use to do things like request certain subsets of data to be provided to them. And I also help to manage the trusted research environment that we have, which is a place that researchers can go to work with this private data without being able to export it.
That's great, thanks. So it's already showing just the various different activities which your role takes in. And so you mentioned about the kind of size of the team you have. So what is the current size? And does each person also take on kind of working on these various different aspects together?
Yeah, so I think we've got 6 or 7 people in the team at the moment. So 2 different job titles. We have data engineers and software engineers. It's kind of, we really work across those roles though. So day to day, the job is actually fairly similar between the 2 roles. We've got a couple of senior data engineers. I'm a software engineer, and then we've got a couple of junior data engineers as well. And we've got someone new starting at the team in a couple of weeks.
Cool, excellent.
Yeah. So you were talking about the trusted research environment. So I think one of the things our listeners are quite interested in is for patient data. I think safety is a top concern in terms of privacy and how it's handled. So the trusted research environment, or TRE, is something that I think as researchers we all have to kind of deal with. Mm-hmm. So can you kind of explain how the TRE ensures that patient data is kept safe and secure in an ethical way?
So basically the trusted research environment is a cloud virtual machine. So it's a computer that runs on the cloud that you don't necessarily have access to unless permission's given. So the data is then provisioned to you in that environment. So you basically go into a web browser, you'll type in the web address of this trusted research environment, and you'll get a Windows desktop, and all the data that you're approved to work with will be in that environment. So there's no ability to download that to your own PC, send that anywhere, put that onto a pen drive or anything like that. It's all very controlled. You get exactly what you're allowed to get. And then that's provisioned into the TRE, and then at the end of the project, you would then lose access to that TRE, and the data wouldn't have access to that data anymore after you'd done your research.
So it's a bit like a sandbox that the data can't escape.
Yeah, that's basically it. Yeah, there's controls on there, so you can have a limited egress of data, which goes to a team for approval, depending on if you need to take out some graphs or charts or things like that. But it's all very controlled. You can't just download patient data to your own PC and then have the freedom to do whatever you want with it.
That's great.
And it's been quite notable just over recent years that this transition, so we're moving away from the use of physical media to now have these virtual cloud environments set up to enable ethical and reasonable access to these data. So it's quite incredible to see the technological shift which has basically allowed this to happen.
Yeah, it's quite a change, because I guess the only alternative really is then to have a controlled room that you go and work in. So being able to do this over the internet allows you to do things like work from home and increases the flexibility of working with this data while keeping the same level of security.
Yeah, great. So I'm interested. So we've had some people on with different backgrounds on the podcast before. As a data engineer, how did you come about getting into the role? Like, do you mind telling us a little bit about your education, any experience you had before coming to CHIL?
Yeah, sure. So I started out doing a degree apprenticeship with Airbus. So that was in aerospace engineering. And I worked there as a fatigue and damage tolerance engineer. So basically performing calculations on the life of airframes and structural integrity. They were going through a big data transformation project at the time where they were looking at using lots more data, so they put a big focus on people upskilling in these data engineering tools. So I kind of picked up that as part of my day-to-day role and got some experience, and then eventually decided that I preferred that sort of work to the aerospace engineering, and then looked for a role doing that full-time, and found this role at CHIL which looked really interesting and was doing quite similar things to what I'd been doing before, so decided to move over.
That's great. And so with that kind of industry background and experience, but then the role within CHIL, the fact that CHIL's looking to bring together, so it's like the academic side, but then equally the public health agency side, the industrial partners, local region government, etc. So the fact it's got this multiple group involvement, and then it brings in people with a blend of experiences and backgrounds in terms of their previous work, who can then bring that what they've gained from that to their role as part of the team. So just in terms of, again, from your team members, in terms of the different experiences you've all had, how do you find, does that like help complement each other in how you work together?
Not too sure on that. I know we do have a couple of people from different backgrounds. So some people are basically just from university. I know some people have worked in the private sector, and then some people are from sort of a public sector background as well. But I couldn't really say if that makes a huge difference to how we work. I think it's always good to have various backgrounds, though, because you do pick up different skills and different ways of working, especially between the private sector and then the academic public sector. Yeah,
very fair.
Yeah, I think it's super interesting, because I think the more wide range of skills you have in a group, people just pick things up. And I know, especially in an interdisciplinary area like CHIL, you kind of need the clinical people and the maths people and the computer science people to all come together and kind of bring the engineering and the clinical side together. So day to day, so there's a lot of work with working with cloud environments and kind of working with software engineering. Are there any elements of your role that you weren't really expecting to take part in as a data engineer?
So I would say my previous role was quite well defined, because it was such a huge company. You were very much in a box and would be doing sort of you'd have well defined job responsibilities, and if something fell out of those, there'd always be a person to go to another team to solve that problem. I guess the difference working with CHIL is that it's quite like a small startup type environment, so you end up having to jump in and get involved with any problems that come up. So I'd very much worked on the sort of data engineering, data analysis side in my last role, whereas now I'm getting involved with quite a lot of things like system administration, like cloud administration, deploying infrastructure as well, which I think is a good thing, because it's let me pick up skills that you might not get in a role with such well-defined responsibilities.
And with these type of tasks you carry out, would you say, do you have quite a routine day-to-day, quite like familiar structure, or is it very variable how things go day-to-day, week-to-week, dependent on project tasks?
Yeah, very variable, I would say. We basically track our tasks using like a Kanban board, which has like a set of cards you can drag between what you're currently working on, what you'll be working on next. So it's basically just what cards come in. So maybe a certain piece of infrastructure needs to be deployed, or something's broken, needs to be fixed, or you're looking at working with a company that needs a certain subset of data, so you might have to build a pipeline to provide that data to them. So I'd say the work's different every day, really. Yeah, no 2 days are the same.
Cool. No, it's very cool.
Cool, yeah. So obviously we all work within the kind of sphere of public health. So we've had kind of project managers in before, we've had mathematicians like Ed. But this is the first episode where I think we've had someone from the engineering, software engineering kind of side. So we've been asking everyone if members of the public or listeners want to get more involved in kind of public health research or towards the kind of ethos of CHIL, how they can get involved. So from a data engineer's perspective, are there any things that our listeners can do to kind of either make your job easier or kind of make CHIL more effective from the data engineering side?
Not sure about the public, I suppose. I guess one of the big things that data projects depend on is consent of the use of data. So it's very controlled, sort of what data you can use, especially for the NHS. It's all relies around consent. So I guess the best thing is to educate yourself and maybe read up on some of the benefits that the use of this data can provide, because it's kind of a I guess a lot of people need to allow the use of their data for these projects to be run. So it's like it's very easy to not consent to your own data being used, but then if everyone does that, then it gives very limited data to work from. I guess from the data engineering side, maybe we could publicise more about the safety controls being used for the data, because I know there are the odd well publicised data breach, and that really reduces confidence of the public in allowing the data to be used for these purposes.
Cool. And with the thinking about those who might just be still in higher education or by thinking about course choices, etc., is there any advice you might give about the types of kind of useful modules, courses, if they were looking to get involved in like data engineering, software engineering type work, perhaps with a health type application?
I would say the biggest thing would be just to try and build some real applications, so it doesn't have to be anything crazy complicated, but there's a lot of the data engineering tools are open source, so they're freely available. You can run those on your own machine, or I know most of the cloud providers provide some cloud credits. So I would say a lot of people are doing sort of data related courses. It's very popular at the minute. So I'd say the thing that would make you stand out is to show how you've taken some public data, ingested that, create a pipeline, put that into some sort of data storage, and then done some analysis, because that's a lot of what the job's about. And that'd be really valuable, I think.
It seems there's provision for these opportunities in terms of from them cloud services, etc., for people just to engage if they would like to with them, and so be able to try things out, which is great. So no, I think that seems like very, very sensible advice.
Yeah. That was brilliant. Thanks, Albert, for coming on the podcast. I think it was very interesting hearing about the data angle and data governance kind of side of things. For those of us who want to follow on social media, you can follow us at Blue Sky, at CHIL.
And feel free to give us a like or comment us on Spotify or YouTube, or wherever you are listening to us or watching us.